life, we go through a lot of challenges. I mean, there's stress, illnesses, sickness, so many things that we deal with on a regular basis. But on this episode, we're going to talk about multiple sclerosis, breast cancer. Man, I tell you, we got a wonderful young lady that we're going to talk to today. She has been through not one, but two illnesses.
Major illnesses.
Like, that's crazy.
Totally crazy.
You don't want to miss this one. Life Stripes with Kathy and Duke. Stay tuned, because we're coming. Not one, but 2 parts.
2 parts. Our first 2-parter.
2 parts.
That's how awesome this setup is. She's good. You don't want to miss this. Everybody, and welcome to another episode of Life Stripes with Kathy and Duke.
Hello, everybody.
So, as promised, we have a very special guest with us today, Naqia Ahmed, and we're going to be speaking about MS, multiple sclerosis, and also breast cancer. Naqia, how are you today?
Good, thanks. How are you?
I'm very good. Very, very good. So, tell us, Naqia, how did all of this come about? I know MS you had initially. So do you want to talk to us a bit about that?
Sure. So I was diagnosed with MS in 2007. So I was in my mid-30s at the time. And it just started with feeling tingling and numbness in my toes. And it kind of just spread upwards. And I went to the doctor. I was freaking out. I knew something was wrong.
Right.
They actually told me, don't worry about it. I requested a referral to a neurologist. So she referred me, but on the referral she put as requested by patient.
Really?
Wow.
Yeah.
So, I mean, that's a testament to you advocating for yourself, first of all. So that's amazing. And then the second thing, why a neurologist? Like, why did you go straight to that?
Because my cousin is a neurologist, so I knew that that's the person that I should be seeing.
Oh, okay.
So,
interesting.
Yeah. Otherwise, I may not have known that.
Right. Yeah. Okay, so this is very good information for people because and I know a lot of people feel tingling. Don't you sometimes wake up and your hands are tingling or the circulation? You just assume it's circulation. You slept on.
But the thing is, it goes away. This didn't go away.
Got it.
So like that's just, something that doesn't go away. It's consistently there. But also I think if you know yourself and you're in tune to your body, you know when something's wrong.
Something's wrong, yeah.
And
Absolutely.
A lot of the times the doctors will be dismissive.
Yeah.
So it is really important to advocate for yourself.
Yeah,
excellent.
For sure. And also know your body.
And pay attention.
Yeah.
So if something feels off.
And how long did that go on for? Like you felt the sensations for how, like a day, a week when you knew?
No, it was like weeks.
And so you're just sort of waiting for it to go away.
Right. But I went to the doctor very quickly.
Okay.
Yeah.
Okay.
Wow.
But with the tingling though, was there any like pain that associated with it?
There's
or
no
anything
pain,
like that?
but it was numbness as well.
Okay.
But it was spreading. So moving from my toes to my foot and then up my leg, and it moved up to my waist.
And any trouble walking at that point? Or?
My legs felt heavy.
Okay.
So I didn't have trouble walking because it wasn't affecting my muscles.
So the mobility was okay.
Yeah, I was just a little slow because my legs just, like when you feel numb, things feel heavy.
Right.
So that's what it felt like.
Okay.
But there are a lot of other symptoms with MS as well.
For example?
Fatigue. I started having some vertigo as well.
Oh, wow.
There's just so many symptoms, but like you don't know.
Right. And so what you're saying is that people can have symptoms that may not be the same as someone else, but it's still MS.
Absolutely.
Okay.
But you won't know until you have an MRI and they actually confirm
that's what it is.
That's what it is.
Right.
Interesting.
So with MS, how has that changed your life, your day to day?
So at the time when I had the flare, it takes a few months for it to go to its peak, I guess, and then it just starts to go away on its own. They can give you steroids to help.
Okay.
I didn't take any because apparently in that spectrum of like the symptoms that you're having, mine was pretty mild.
Okay.
Mm-hmm.
To me, it didn't feel mild.
Okay.
But it was mild because some people, when it's affecting your muscles, you don't have that mobility.
And
right.
Is that because you caught it so quickly? Does that have something to do with it?
Oh,
okay.
No, it presents differently with everyone.
Got it.
Okay. I also, because the referral was requested by me, it wasn't urgent, and my symptoms were not that severe.
Mm-hmm.
I was waiting and freaking out because at this point I didn't know what it was. I knew that it might be MS.
So you actually thought that?
Yeah, but again, it's because
I have a family member.
I have family members that are physicians.
Got it. Yeah, that
so
definitely
they
helps.
gave me a lot of information.
Absolutely helps.
And so there was another day where I still was waiting for this referral. Things were getting worse. Right. I'm freaking out. I drove myself to Emerge at the hospital because I was like, I need someone to see me.
Good for you, though. Right? Good for you.
I drove to Emerge at St. Mike's because I was living closer to there at the time, and asked them again to refer me to neurology.
So now you just want to see who's going to do this quicker, right? Which one's going to...
They're probably in the hospital like her again.
Yeah.
Like, why don't we just give her a lab coat?
Yeah, exactly. Like, do yourself.
Can you handle that patient over there since you know so much?
In my mind, it was like, if I have 2 referrals,
so one of them has to come through quicker than the other. Yes.
Or maybe they'll think, oh, maybe this is more urgent.
Yeah.
So they actually called me. So I was in the office. I went to work. They called me saying, I have a cancellation.
Oh, good.
Okay.
But I think it was because I called them. So again, I was being
proactive in your health.
If I didn't do all of that, I don't know how long it would have taken.
No, good for you.
Oh, you're definitely persistent.
Well, imagine your legs being numb and the numbness getting worse every day. And you're like, I don't know what's wrong. And they're telling you, well, we're not sure, but we're not going to do an MRI anytime soon.
Right. Yeah. And you are healthy. You from that before that, you're totally healthy.
There was no there was nothing that would have said to me that something like that was going to happen.
Okay.
So yes, I remember that I called them. And then she called me back like an hour later and said, we have a cancellation today.
Wow.
Can you come in like 2 hours or whatever? So I worked downtown. The hospital was not that far. I just hopped on the subway.
Good for you.
I went. I saw. Yes. So I saw the neurologist.
Good.
But then you have to wait for the MRI.
Yeah. Okay.
So
I heard that takes a long time.
Yes, it does. It can. I kind of got lucky there as well.
Wow.
I'm thinking persistence played another.
What did she do?
I know. So to all of you watching at this point, I know you see that we're very engrossed in this conversation, but I think it's also because of persistence. Like if that's going to be the message of today, if you leave with nothing else except this, be proactive in your own healthcare.
And just advocate for yourself when you know that something is wrong. Because the waiting when you don't know what's wrong,
it's very stressful.
It's torture.
Yes. Yeah. That's a perfect way to say it.
Because it is.
Yeah. And you can get scared about it and do nothing, or you can get scared enough to do exactly what you did. So good for you. I commend you.
So they then called me and said that I could be waiting months for this MRI.
Wow.
So let's say a couple of months. So again, I was like, I can't go through like 2 months of just not knowing. Because until they do the MRI, they can't tell you what's wrong.
Right.
Yeah.
So a family friend happened to be a radiologist at Toronto General.
Okay, so...
All right. She's got links. She's got links. So can I tell you about my back?
Do you got a chiropractor? No, just in your back pocket. I know we're
actually a physiotherapist.
See, there we go. So anybody out there with issues, Naqia has the hookup. Okay. I love this.
To the left, to the left.
Anything you need.
I never appreciated all of these people before. I mean, no, I appreciated them, but but not in that way.
Right.
Like,
Of course,
you kind of just you don't think that
absolutely.
Well, the thing is,
what they do matters.
Yeah.
And the thing is, when there's nothing wrong with you,
you're
don't
like, okay, that's what they do.
Like, why do I need to know
exactly?
A meteorologist? Or,
that's exactly
meteorologist.
Right.
Meteorologist. You're talking about the weather.
This is crazy. Yeah. So a neurologist. Yeah. What do you need to need?
Radiologist.
You need to know a neurologist for. Yes.
Yeah, it's a winter blues.
It's a winter blues. You're so ridiculous. We have too much fun here. Can you tell?
Fun is good. Fun is good.
Yes.
So my mom's friend got me the MRI within 48 hours.
Love it.
So I was thank God for my mother being a social butterfly, which I actually used to hate growing up, to be honest.
Well, there you go.
Hated it.
Wow.
Because she was never home or she,
she's out flitting and floating around in her thing.
Annoying. Yeah. Okay. And then I was like, thank God.
Yes.
Because that really, really helped. And then I went and saw the neurologist and he told me that I had MS.
So he told you then and there? So you did the MRI, he gets the results back.
And then you go for your follow-up.
So now here is the question. You're sitting in the office.
Yeah.
The news is delivered.
Yeah.
What happens? What goes through your mind?
Oh, well, I just started crying.
Yeah. Were you there alone?
Yeah.
Oh, okay.
Ooh,
okay. Okay.
And I'm someone that generally just was always very independent. I just always did things on my own.
Yeah.
So, I just went.
Wow.
And I wasn't even thinking that, I need to bring someone with me. Mm-hmm. It just, because it was my normal.
Yeah.
Mm-hmm.
But he was actually really good in the sense that, I broke down because you don't know anything about this. So you're thinking, oh my God, I'm going to be in a wheelchair.
Right.
My life is over.
Yes.
And he said to me, that's not what's going to happen. Good. That doesn't happen to 80% of people with MS. He said, what you see on TV is probably what happens to about 20%.
Interesting.
Yeah. So that was really eye-opening.
Okay.
Yeah.
And he said to me, he thinks that I'm pretty much going to be fine for the rest of my life.
Okay.
Because it was mild.
So give us the range. I guess you have right, who's mild, and now there's a spectrum.
There's a spectrum for sure.
So what is
someone that's more
severe?
So chances are it's going to affect their muscles, and the myelin covering on your nerves is what's being attacked.
Okay.
And so that's going to deteriorate, which is why your nerves, it's neurology, so it's going to control everything. So they wouldn't be able to walk.
Right.
But because it's your nervous system, it can affect anything and everything.
Right.
Like your breathing, your just anything. But most people that are more severe, it is their mobility, their muscles.
Okay. And you haven't progressed.
No.
Since your diagnosis, that has not progressed.
Yeah.
So what has sort of been a preventative? What are the tips and tricks of what people can do?
They also there's medication that they can put you on that you have to stay on for the rest of your life. I initially, you go to another clinic, and then that neurologist, I think she was a student or doing her fellowship or something, but she was pushing the medication. I said no.
Okay.
But she made me feel like I'm an idiot for making that decision.
Wow.
So that was pretty horrible. And I actually did tell my initial neurologist about that because it was upsetting. I said no because I just thought, you know what? I just kind of want to wait and see how things go. It's not something I'm saying I'll never do.
Right.
But there's so many side effects with those drugs.
Okay.
That I just didn't want to go through that if I didn't have to. And because he said to me that he thinks that I'm going to be fine.
Yeah.
And I mean, he was just really nice and in terms of his bedside manner, because not everybody has that.
Yeah.
And he said, I've been doing this a long time and I don't think you're going to get to the progressive stage, because there's remitting relapsing.
Okay.
And then there's also where it's progressive.
Right.
So remitting relapsing means that you have a flare, then you go back into remission, and you're fine.
You're fine,
right? And your relapses can be every 2 years. They can be whatever. But the first few years or 5 years is when you'd get a better sense of kind of how it's going to go. For me, after that first flare, I had another flare a few months later, which was very similar to the first one.
Mm-hmm. So the numbness.
Yeah. And then after that, that was the last time I had a flare. So that was 11 years ago.
Oh, wow. Well,
so,
yay. Good for you.
So that's why I was like, okay, let me just see how things go. I never went on the medication.
Yeah. Okay.
But to answer your question, I did change my diet.
Okay. Okay.
I was kind of freaking out and just, you want to like do everything that you can. And I tried to sort of do it in a way where I could see is something affecting me.
Oh,
so if there was one day where, I don't know, I had like a whole bunch of cookies. We had them at work, so I just kept eating them. And,
let's just try and see if I'll get a flare up.
Okay. Made me feel better.
Like, and you're working and you're stressed and there's like this bowl of chocolate chip cookies.
Right.
Yeah.
After that, I started having weird like tingling sensations.
And
I was like, oh.
Yeah. Okay.
So it wasn't an actual flare because a flare will last like a month or 6 weeks or whatever.
Really?
Oh, yeah. So it lasts
there is no
a while.
Cookie worth that.
And then it kind of goes down.
No.
I mean, there's a
so this was like a few minutes.
Really? Really? God. If you didn't hear it, it's okay. Yeah.
but like I just did notice like some tingling and then it went away.
Yeah.
I was like, okay, the sugar, not good.
Not good.
So I changed to almond milk at that time.
Okay.
And just tried to overall just eat better.
Yes.
Yeah. But I never went on any medication for that.